helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. I'm Hattie Cheek. We have Jessica Granger with us and Joseph Assaley from Cabell Huntington Hospital. And today we're going to be talking about women's health, something that's, obviously very important, but cervical cancer in particular, at least to start with. So how prevalent is it in our region?
Well, cervical cancer rates have fallen dramatically over the last several decades. And in West Virginia, the most recent data I've seen from the CDC in 2011, we have in the neighborhood of about 7 to 14 per 100,000 women that will be diagnosed with cervical cancer in our state. And we have about somewhere between 3 to 6 per 100,000 women that will die of cervical cancer in our state. But our state's a little higher than the rest of the country. Okay. There are over 500,000 cases of cervical cancer a year worldwide, and the majority of those are in underdeveloped countries.
Okay, but in West Virginia we are a little higher than the national average. What are some of the signs, the symptoms that we can expect?
The most common signs and symptoms that you get with cervical cancer are a change in your vaginal bleeding, spotting after intercourse, or with just in between the periods, just something that's not normal for the woman, are the major early signs.
Okay, so that it's not going to be you feel fluish-like symptoms, nothing like that?
No, not typically.
Okay, all right. So is there a good way to screen for it? Since there aren't so many signs, you're not going to notice, oh, I don't feel well today, I'll go to the doctor. It's not quite like that, so it's a little harder for you to catch on your own. What kind of screening ways do we have?
Well, the classical way to screen for cervical cancer is the pap smear. A man by the name of George Papanicolaou developed the pap smear, published his first paper in the New England Journal of Medicine in the 1940s. And over the decades since then, the technology with pap smears has changed. So now screening by pap smear is the recommended method for detecting cervical cancer. Most recently, those screening guidelines have been updated, and with better technology in how pap smears are read and performed, we changed the guidelines. Guidelines include not just cervical pap smears, but also tests for something called human papillomavirus.
Okay, and you get one at the same time?
It's upon your age. Categories depending on the age. So for the women, 1 to 20, there are guidelines. And for women, to 40 to 65, there are guidelines. And those guidelines are different upon the age and depending on the patient's history.
Now, I feel like there's somewhat over this different things. How frequently should you be getting done?
So pap smears don't start until you turn 21. For everybody, until 20 years old. And then after that, like you were saying, from 20 to 21, if the initial pap smear is normal, you don't need another one for 3 years, every 3 years until you turn 30. And then it's the recommended screening frequency to combat not only the pap smear, but the testing for HPV. And if screening at that is normal, we do that every 5 years.
Well, you said 21 is the typical time, and if they were actually active for 21,
Correct.
still just 21.
New guidelines came out and said regardless of age, you become sexually active, screening at age 20.
Does it have to do with the sensitivity to screening?
A lot of it is that young women will contact HPV during their first sexual encounter. It is a virus, just like any virus you can get, and so many of those women will cure the virus on their own.
Okay.
And also, cervical cancer is just not very prevalent in the population under 30.
This kind of leads to the wellness, and what is that?
Well, wellness exam is a wonderful opportunity for the physician and his patient to establish lines for maintaining a healthy lifestyle, lowering risky behavior, keeping with immunizations, and things like that. So I encourage my patients to continue to tell women that every year, even if we don't have to perform a pap smear part of that. Well, women also are categorized according to age. So group 29, and over 30 would varies.
Really quick, you do advise women pregnant to get a shot during the women exam. If you need more info, just go to our website, WSAZ.com, click on that.